And it's more bogosity surrounding the opioid scare, this time from the Mayo Clinic. It's disheartening to think that now there's an entire generation of young doctors who believe this crap. But here, they've decided to throw the Hippocratic Oath out the window and tell dangerous lies and fearmongering. Claims like, quote, "It's impossible to tell who could become dependent and misuse opioids. The misuse of opioids, legal, illegal, stolen, or shared, is the reason 90 people die in the U.S. every day on average." No, it isn't. As anyone who's watched my opioid playlist knows, this is pretty much due to black market fentanyl. And again, the CDC refuses to break this down, and doctors have been outright falsifying death certificates, so it's hard to get an exact count, but it's only something like 1,300 to 2,600 deaths per year that's due to the prescription opioids. That's at the most 7 a day. And something like 80% of those are polypharmacological, with other drugs such as alcohol or benzodiazepines as contributing, if not primary, factors. That leaves something like 250 to 500 annual deaths from prescription opioids alone. More people die from tripping over their own furniture! And we have the same addiction bogosity, quote, "Addiction is a condition where something that started as pleasurable now feels like something you can't live without. Drug addiction is defined as an out-of-control feeling that you must use a medicine or drug and continue to use it even though it causes harm over and over again. Opioids are highly addictive, largely because they trigger powerful reward centers in your brain." In reality, addiction is none of those things. There's an underlying issue driving the addiction. Drugs don't do it, and people don't get addicted from exposure. And that's also how you can become addicted to things like gambling, where there's no drug involved. As the data in my playlist show, only 0.6% of opioid-naive patients become addicted. And when they do become addicted, it's tied to things such as adverse childhood experiences, mental health issues, and toxic stress. And if you're going to get addicted, that addiction manifests quickly. Taking opioids over a longer period of time does not increase your risk of addiction. And we have the usual bogus signs of disorder, such as crushing a pill before you take it, which a lot of people do, especially older people who have more difficulty swallowing. This does not make the pill more addictive, by the way. As long as you're not crushing an extended release pill, it takes just as long to get into your system. It's just really infuriating when they tell lies like this, quote, "If you're living with lifelong pain, opioids aren't likely to be a safe and effective long-term treatment option. Many other treatments are available, including less addictive pain medicines and therapies that don't involve medicines. If possible, aim for a treatment plan that allows you to enjoy your life without opioids." As I've repeatedly shown, there's only one word to describe this: torture! People have also reported going to the Mayo Clinic for surgery and being denied opioids for recovery, sentencing them to days, if not weeks, of completely unnecessary pain. The Mayo Clinic used to be the gold standard for medicine, and now this is what they've sunk to. If you've ever wondered why so many doctors would have gone along with the horrible forms of torture inflicted on so many during Nazi Germany, look no further. This isn't medicine. This is hate. Nothing more.